Welcome to WOW, the Woman of the Week podcast series from Pharma Voice. This episode was made possible by a generous sponsorship from Ogilvy Health. For more information, visit ogilvyhealth.com. In this episode, Taryn Grome, editor-in-chief of Pharma Voice magazine, meets with Dawn Fallon, practice lead, health, Makovsky.
Dawn, welcome to the Pharma Voice WOW podcast program.
Thank you, Taryn. It's great to meet you.
It's great to have you with us. Dawn, you've had a really successful career leading a variety of healthcare campaigns for biotechnology, medical device, health insurance, hospitals, medical associations, and pharmaceutical companies. That is a broad swath of clients. Tell us a bit about your career journey.
Sure. I started not in healthcare at the beginning of my career. I started in nonprofits and food and wine and travel and tourism. And then I landed in an agency where I was exposed to various healthcare accounts, hospital systems, some pharmaceutical companies. And that's where I really felt that I could really make a difference with working with patients and clinicians. So from there, I had worked with some of the leading hospital systems as well as insurance companies, and then also working with some leading medical device companies from Johnson & Johnson to Medtronic. And then following that, I had the opportunity to work with some smaller pharmaceutical companies to large companies like Merck and GSK. But all in all, it's one of those things for me that, working in the healthcare space really gave me that opportunity to make a difference without what they say, having the MD. But it basically being able to shape the narrative as it relates to my client's story and really elevating them as thought leaders in their particular space.
I love that. I often say that people who work in the life sciences industry could work in any industry, and you're a perfect example of that, but yet they choose to use their talents and resources for the greater good. So that's fantastic. You must get a great deal of satisfaction about working with your clients and helping to shape their stories.
Absolutely. It's one of those things that we all do it for the patient and the patient journey and the patient voice. And I feel like there's so many patients out there with various conditions, from chronic conditions like diabetes and cancer to other conditions like morbid obesity, which is now considered a disease. I feel like there's a lot of patients out there that need to have a voice, and our goal is to get that voice through educational awareness campaigns or campaigns that really elevate the new technology or the new drug treatment that we're bringing to the forefront to help address their needs.
That's a perfect lead into my next question. Given the current environment with so many different channels available, what are some of the biggest challenges for healthcare communicators today?
There are many challenges, I guess, out there. And I think that the big one is, again, the patient. The patient continues to evolve, and the patient is now more informed than ever. So working with clients, getting their narrative straight and really shaping that narrative as it relates to their messages for those key stakeholders, right? So whether it's investors to clinicians to those patients, everything is shaping that narrative for the patient and how they're going to view that pharmaceutical or medical device or health tech company. And I feel like, we have to really shape our narrative around the patient and go where they are. The patient is, again, more educated. They're reading various sources, whether it's the media or social media. We're seeing various age categories turning to social media, going to the Facebook groups, and really engaging with various patients about how they should go through their journey. And I think that's something that as communicators, we have to really tailor every program that we do around that patient and that disease category. Some diseases we know are more vocal than others, right? So like oncology, for example, a lot of patients in the breast cancer community are very vocal, and one influencer can say something and they basically tailspin your campaign. So I think we really need to look at those channels for the patient and make sure that we're giving the right message at that time.
Do you think your clients are understanding the power of social media more now than they were maybe even 3 or 4 years ago? Because it's not going away, obviously, but they've been hesitant to jump into that social media foray as well.
I think it depends on the client. Working with startup companies, they seem to embrace social media a lot more easily because there's less regulation needed, I guess. But the larger ones, there is still a conservative approach. So, again, we work with clients. We try to make the most powerful message for their social media platform, whether it's Facebook or Twitter. And then the client, of course, going through legal and medical review process, they sometimes have to make it less likely controversial, right? And it's one of those things we always try to give that strongest story for our clients and have that happy medium to make sure the voices are heard, but also understand that we're in an environment that has to be in a regulatory and legal medical review process as well. So they are, again, depending on their scope of the nature of the bigger accounts with pharmaceutical accounts, they're more inclined to be more conservative than others.
Sure. And do you think that patient journey is evolving more every day? Because we've been talking about a patient journey 5-10 years, but is it getting more sophisticated?
Absolutely. I think with the iPhone and smartphones for that matter, people are getting their information as they go. So like the media landscape, as we know, is also changing, but that's also shaping the narrative. But patients are going online to get information all hours of the day, right? So we have to be able to understand that and know that at any given point, a patient be going late at night after their work is done, right? And they're going to receive that information, and I feel like that's definitely not going to go away anytime soon.
Fantastic. When you look to the future, where do you see some of the biggest opportunities ahead for the industry in terms of communications?
I think there's various opportunities out there. Again, I think that what we're seeing now, definitely among the healthcare area, is that there are those voices out there, influencers for that matter, continue to become another voice that is not yet been tapped into. And those voices, they don't have to have a huge following, but they have those particular members of those groups that have that voice. And I feel like, influencers can definitely become more of a voice for a lot of different companies based on their disease category. And, people want to hear from people. Companies are important, but it's the people behind those companies that make the difference.
Absolutely. Well said. Having worked on so many different types of campaigns, what are some of the keys to developing a successful initiative? What are some of those tips that you provide to clients?
So before we go in the campaign, we always look at various where the client is and where their narrative is. So whether it's a startup company to a larger company, we always try to look at the best way of who they want to target first, whether there's investors, whether it's clinicians, whether it's those patients, right? And each client has their very storyline. So if it's one that's launching a new pharmaceutical drug, it's one of those things and it's ready to launch, we have to figure out what the narrative is going to look like. If it's a startup company that's large, that's launching a new technology, it's one of those things that we have to create the need to get there, right? So everything evolves and tailored to the specific client that we're at stake. And I think that's so super important. Everything can't be what they call, cookie cutter. It has to be tailored to the specific client need to really reach those KPIs that are needed to make sure we can measure success.
Absolutely. And that's perfect, again, to my next question. So everything has to be measured, obviously, to justify costs, resources, etc. So how do you measure the success of a campaign?
So I think it all depends on the client and their needs. And when we go into a campaign, we look at those particular measurement tools in terms of, like, are we measuring sales? Are we measuring click rates to our website? Those things are really important for various clients. Other times it could be how are we talking about it in the space? Are we bringing awareness of something that has never been talked about? For example, there was a condition that we worked with Medtronic on, a condition called respiratory compromise, but no one knew what it was about. The goal was to create that narrative on that condition, so there was a need that was involved. And then we would see how that coverage was penetrated throughout our media coverage, right? And then also social media. So again, everything is very tailored to clients, and success is measured based on various KPIs based on what the client provides and ones that we develop strategically at the beginning of the campaign.
Awesome. Thank you. We talked a little bit ago about the different stakeholders that are involved. And so how do you knit together those number of voices from those stakeholders and to create like collaborative outcomes? Because they all have different agendas, I would think.
Absolutely. And it's one of those things that, again, based on the pharmaceutical company we're working with, where are they on their narrative story? So, for example, if you're working with, COVID and the vaccine, are we trying to educate the drug community about what's going on with the vaccine? And then part two, how are we going to change that narrative when we have the vaccine approved, and then educate the public about it? So, that's how we look at campaigns. We look at the stage of where the development of the technology or the drug is, and then develop it based on the stakeholder, whether it's patients or clinicians or even investors. Sometimes, we, need to shape the narrative around the investor community because we're working with a startup pharmaceutical company who's looking for capital to raise funds to support that drug development and delivery.
I have to ask, have you ever had to push back on a client based on your recommended strategy? And how did you manage to navigate this tricky negotiation?
That's a very good question, and it's one of those things, especially in the nuance of drug development, is always a challenge sometimes with clients. And I think that one of the things is that sometimes clients want to go forward with their narrative sooner than it's ready, right? So we all know that clinical data, whether it's a medical meeting, a published study in a medical journal, is that much more important than just getting the word out about the actual drug treatment. And so what we try to do is advise clients, right? If they want to talk to the consumer, that they have to slowly build their narrative from the scientific perspective in order to validate what's going to happen later down the road for consumers. So that is something that, in the media landscape, again, we know the media is very challenging and shrinking, that the more clinical and hard data we have, the better our story. I think that's sometimes challenging with clients when they want to first go after the patient, when you still have to build that narrative that's involved in building that scientific data and foundation.
So it's really a series of building blocks, and you understand what those one thing leads to the next thing leads to the next thing. So there's a lot of education you have to do with your clients as well, I would think.
Absolutely. It's one of those things that, especially for the smaller startup companies to mid-sized companies, they're still, beginning in the store, they're just super excited about their treatment option, and they want to get the story out there. But there's, again, those, like you said, those stepping blocks that are needed. So again, educating the clinicians who would be embracing that treatment to eventually treat those patients. You can't jump from point A to point D. You have to go through A, B, C, and D to get there. And I think that's something that's, a lot of, companies that are the small ones, to mid-size, they're still kind of learning their narrative, and it's important to kind of get them in the right track and letting them know that, they'll get there eventually, but there's certain moments in time that they have to hit and check off before they get there.
That's great. I don't know that people really understand that there's such a science behind public relations and communications, because they think they can write a post and that's what it's involved, but it's so much more than that. And how do you explain, when you bring in new folks to the practice, how do you lead them through this education process for them as well?
So kind of like, I guess, when you go back to what if you reflect about, in college, it's really understanding and reading up on the disease category and the disease treatment and how that is affecting the journey of the treatment option for the patient. So again, arming them with information, again, medical journals, you can't go wrong with them, sending them to those websites, but also looking at those leading society groups that have been those voices for those disease categories. So I think that that's really critical to get your team up to speed on the disease category before they are onboarded with the client. And then also, ask questions along the way. They always say there's never a dumb question, and it's true. And I encourage team members to ask those questions before we onboard them for a new client that, will expect you to be an expert in that particular area or category.
Awesome. How would you describe your leadership style?
So for me, I think, again, with clients, I tailor, based on each individual. Everyone takes leaders differently. Some of them need more handholding than others. So I kind of pivot based on the person I work with. So for example, if there's someone who really just needs to check in every week, others may need it every 2 weeks. And I think that you have to give people time to breathe, and then also that time of moments of making sure that person is learning every day and becoming the better person as an employee.
Certainly, there are a lot of younger people that come into the public relations communications field. We're dealing with Gen Zs now, and then you have to manage folks that maybe are in that millennial, and maybe even some more, we call ourselves maybe more senior folks. And how do you have to adjust your management style for all these different employee cohort groups?
Again, similarly, I think it's based on the individual person, and from what I've done in my 20 plus years working in public relations, I've noticed that I don't look at a person at their age. I look at their skill level and where they are in their journey, right? So people come from different backgrounds and they have different skill levels. And what I notice is that, again, there's someone that will be passionate about other things than others in various skill categories, and I try to embrace that. And then in other areas where they want to learn but they're not there yet, I give them those tools to get there. And I think it's very important as leaders to continue to shape your people, because your people are your best asset.
Exactly. And that goes back to that mentoring and sponsorship. And how important is that to you personally to mentor that next generation?
It's extremely important. Everyone from an AAE to an SVP on my team, I think it's very important to be that mentor to them at any given moment. And in my journey working at various agencies, I still keep in touch with other colleagues that I worked with over the course of the years, because I just want to invest in their career. And for me, it's so important to give back. I always joke and say, one day I'll be working for you one day. And I've seen that. I've seen some former colleagues of mine that I've mentored that they're now working in-house. And so again, it's about giving back to the people that you really want to invest in and really help them grow, and because they're the future leaders. And I think it's really imperative as communication experts and senior leaders to invest in the future, because they're going to be running the show one day. And I think it's great. It gives them an opportunity to strengthen those legs and those moments, and really help us build that the narrative that's needed in today's environment.
Along that vein, what are some of those leadership traits you look for in others when you're building your teams and you're looking to move folks up the ranks?
So definitely one of those things is passion. I think especially in healthcare, you have to have the passion that goes with things. There's nothing like passion that really drives that person to do their best. And I think that's so important for every team member that comes onto my team, and people I engage with, whether it's through networking associations that I belong to. But I really think that passion is super important, that people bring that to the table. I also think that that driving vision. I think that, again, goes hand in hand with passion and drive, is that, the ones that are looking to be better every day, not about their peer, but about themselves. And I think that's critical for everyone, is that, when we look at ourselves, is that be the best person you can be. And, we know that definitely during this difficult time now that we're dealing with right now, people are struggling. And so, like, how do we get them to get there? And I think that, give those people those tools to be empowered to really bring on the best performance they can, given what's been going on these days.
And let's talk about what's going on these days. We are facing a number of different issues between diversity, COVID-19, and so on. So I know you're doing some work around diversity inclusion with your global agency partners. Tell me about that work.
Sure. So actually Makovsky belongs to a group called IPREX, which is a global platform of about 1,600 professionals in about 100 offices. And, the goal of that network was actually founded by Ken Makovsky, who is the president of our agency. And, his vision was really to bring a collected group of agencies that were independent, that we could work together for a common vision. And, with the dialogue that's been going on in the climate that you had mentioned about diversity and inclusion, that's something that, we really feel deep about in terms of IPREX, but also at Makovsky. And for IPREX, we're trying to really continue to encourage that dialogue by sharing those resources that are working for our teams and our team and our agencies globally, but also encouraging engagement and action, right? Because, I'm hearing from folks all the time, and you read all the time, is that, people keep talking, but there's no action, right? So again, starting that plan, but also execute and sticking to your word is super important. And in July, I'll be speaking on an upcoming panel at the annual global conference, and we're going to be focusing on diversity, equity, and inclusion. And then we'll also be talking about, what we could be doing better and what we should be doing now and in the future. And I think that's critical for today's future generation, and as we retain and recruit more talent into communication.
Excellent. And I love that you're looking to see what you can do better. It's not just about what we've done, but how do we move the ball forward in a purposeful way?
Absolutely. And it's one of those things that we got to continue to do it. And, we read in various publications that we got to do a lot more. And it's true, we do. And I think that we just got to pick and choose how we're going to do it the best way we can, because we can't hit everything. And I think that, it's an opportunity for us. It's an opportunity for us to embrace change and make a difference. And, I think we could do it as a group, whether it's communicators to working with our partners globally.
Excellent. Well, I wish you much luck with that, and I look forward to seeing what the results are of this initiative. So, Dawn, finally, throughout your career, it's been real successful. You've had a number of touch points with a number of clients. Tell me about a wow moment in your career that has either left a lasting impression on you or maybe changed the trajectory of your career.
So for about 9 years, I had the opportunity to work with actually one of the largest bariatric surgery nonprofits, the American Society for Metabolic and Bariatric Surgery. And, that really for me it was a critical moment in my career in changing the way we talked about a disease, morbid obesity. And, working with a nonprofit and elevating them as an expert in that space was really rewarding in terms of creating that narrative about, again, that it's not a health condition, but a disease. And I feel like that moment in time really helped me understand why we do what we do and how we can change the narrative. And as a result of the efforts, working with this largest society group, we were able to, get some national press about why we changed the name from the American Society Bariatric Surgery to the American Society for Metabolic and Bariatric Surgery, due to the issue that obesity was not just a health condition, but a disease. And, through that moment, we were able to change various things and voices, and also influence clinicians who were working in the front line about weight loss surgery, right? And, what was happening there. And, I feel like, there was always a stigmatism with various patients and their obesity story. And I think that's something we got to look at too, when we look at campaigns and everything. And that was something that really, to me, was a critical part in my career, about really knowing how we can shape the narrative to really change, to make a change and how we talk about a condition.
That's fantastic. Thanks so much for sharing that and the important work and the important role that public relations and communications plays in shaping the narrative around so many critical diseases in the industry, and the good work that companies are doing to eradicate those conditions. Thank you for being part of our WOW podcast program. I certainly appreciate your insights and your time.
Great. Thanks so much for having me today.
Thank you for listening to this episode of WOW, the Woman of the Week podcast series by Pharma Voice. And thanks again to Ogilvy Health for sponsoring this episode. For more information, visit ogilvyhealth.com. And don't forget to check out our other episodes at pharmavoice.com/wow. This 2020 program is copyrighted by PharmaLinks LLC.